Madam Speaker, I rise to discuss the health care legislation that has just been signed into law and to discuss the state of the American economy and in particular the state of federal spending and federal debt. Regarding the health care legislation the President signed into law today, it was unanimously opposed on our side of the aisle, and in my case it was opposed principally as a result of what I believe is a fiscally irresponsible approach. Certainly we need to reform health care in this country, and I was supportive of a proposal that permitted the purchase of policies across state lines, major medical malpractice insurance reform, making sure that young people had the opportunity to stay on their parents' policies until their middle 20s, and the pooling of small businesses together. I think that this would have been an approach that would have received wide bipartisan support. However, the bill that became law today is not balanced over the next 10 years. The Congressional Budget Office reported over the next 10 years that this does not include spending for the so-called doctor's fix. That is roughly $200 billion. And there is no one on either side of the aisle who believes that we will not engage in that appropriate expenditure. In other words, if that were included in the cost over the next 10 years, the bill is not revenue neutral. It is in the red. There was an interesting op-ed piece in the New York Times on March 21st by Douglas Holtz-Eakin, formerly the director of the Congressional Budget Office. And Mr. Holtz-Eakin is widely respected on both sides of the aisle. The Congressional Budget Office obviously is nonpartisan in nature. And what he states is that unless there is a realistic assumption of what is going to occur, then there cannot be a realistic assumption of the total cost involved. He states, fantasy in, fantasy out. And the first gimmick he cites is the fact that we front-load revenues and we back-load spending. In other words, revenues increase over the next 10 years, but the spending does not increase until 4 years from now. 10 years of revenue increases as opposed to 6 years of spending. This can only occur once, and moving forward into the second decade, of course, that will not be possible. This is an excellent example of why, over the first decade, the health care bill is not deficit neutral. It, in fact, is in the red, something that should be of concern to all Americans. This is an example of a larger problem in this country. And the larger problem in this country is that we have a $12 trillion debt, and that debt is rising rapidly. Last year, our annual deficit was $1.42 trillion. This year, it is expected to be $1.6 trillion. The highest annual deficit as a percentage of gross domestic product since 1945 at the end of World War II. Over the course of the next 4 years, debt will increase dramatically. And I urge the Obama administration to begin to address this fundamental issue that really confronts us as a nation and certainly confronts the next generation. Moody's, the rating house, has indicated that it is not clear that we will be able to retain our AAA bond rating. And this, of course, would be tragic for the American people, tragic for our taxpayers, and indeed tragic moving forward, making sure that America remains in its position of preeminence in the world. Moody's cites 3 different criteria as to whether it will reduce the AAA bond rating of this country. First, the amount of debt we are taking on. And of course, that includes not only debt here at the federal level, but also debt at state and local levels as well. And we are taking on enormous debt, as I have indicated, and so that's not a good sign. And then, of course, whether or not federal deficits will increase over the next decade and as a percentage of gross domestic product, and this is the highest it has been since the end of World War II. Moody's is also watching another factor to see whether we borrow less in the future and whether or not we raise taxes, which I oppose, or cut spending, or both. Moody's is looking at that. Certainly, we should engage in fiscal responsibility in a way moving forward to get our fiscal house in order. Thank you, Madam Speaker.